Welcome to First Builders, the podcast for those who shape companies from the ground up. I'm Amber Illig, founder and general partner at the Council Capital, where we invest in early teams solving critical problems in essential industries.
And I'm Rachel Choi, partner at the Council. This podcast is about a group of people who are more likely than average to land executive roles or found unicorn companies. We explore the moves that propelled them to where they are today and what early stage founders can learn to accelerate their own growth. We call them First Builders.
Now, whether founders or early team members, First Builders have created functions, teams, and processes from scratch, tackling the toughest phases of growth. And they don't just work at great companies, they join in the formative years and help define them.
And today's guest exemplifies that pioneering spirit. We're super excited to welcome Jason Prestinario, CEO of Particle Health. I've known Jason now for almost 6 years since deciding to work on his team at Komodo Health, and now have been friends working in the same healthcare sector.
Jason's journey is a fascinating blend of engineering prowess and healthcare innovation. With degrees in mechanical engineering from Stanford, he transitioned from Palantir Technologies to leadership positions at Komodo Health and now leads Particle Health, a company revolutionizing healthcare data interoperability.
Particle Health is on a mission to unlock the power of medical records through an intelligent platform, aiming to put the focus of the health back onto the patient. Under Jason's leadership, the company is tackling one of the healthcare's most persistent challenges, seamless and secure data exchange.
Jason, welcome to First Builders.
Hey, great to be here. Thank you for having me.
Yeah, awesome to have you. So let's just dive right in. Your background is rooted in mechanical engineering. Actually, me too. I'm not doing anything like that nowadays, and I'm not sure if you are. But how did you find your way from that field into the complex world of healthcare data?
Yeah, no, it's awesome to meet another mechanical engineering person for sure. I will say when I was studying mechanical engineering, the ME of mechanical engineering was always mostly everything was the
Yes.
sort of framing.
It's
So
a good catch-all.
yeah, I do think that a lot of what I appreciated about that background was frankly just the ability to think about problems and problem solving. Having said that, I didn't know that I would necessarily get into healthcare. As you mentioned, I really sort of started off my career at Palantir and realized that I really enjoyed data and data science and just using data to solve complex problems. And then I just got fascinated with healthcare as an industry. And in 2016, right, launched or left Palantir to join Komodo and really sort of launch and push forward their data and data science teams. So that was sort of the kicking off point for me, which was really just that combination of loving how data can be used to solve problems, combined with feeling like healthcare was an interesting domain in which to solve problems.
And when you were working at Palantir, were you working on the healthcare side? Is that what kind of introduced you to it? Or was there something else that, made that switch essentially?
Yeah, it's interesting you asked that because it actually was one of the few industries that I didn't spend much time in. And I think that was part of what really fascinated me and drew me to it. So I, worked in finance, consumer packaged goods, energy, insurance, right? I kind of worked in all these various verticals. But really just thought that healthcare was an area that, again, I kind of looked around and, it was my dad has actually dealt with prostate cancer for a really long time, and he is managing it quite well up until this day. But it was just an area where I really felt could use the ability to better use data, and so I kind of started learning more and more and more about it and ended up deciding that's where I wanted to spend my time.
Awesome. And then transitioning from engineering roles, very focused on data science, to executive leadership, especially as now CEO of Particle Health, it's a significant shift. So what kind of motivated you to take on that challenge?
Just took over as CEO of Particle. But it is a great question. And I think even before I jumped over to Particle, as Rachel knows, I really took on a role in effectively being a general manager of a business unit at Komodo. And, I think part of the reason that I was really driven to do that, and part of what I always try to keep in mind today is healthcare is a really fascinating industry because there are a lot of problems that look like technology problems and data problems, but are not, in fact, technology problems or data problems. There's a whole lot of other aspects that you need to work through. When I think about sort of data being used in healthcare and you think about HIPAA and privacy and everything that goes into it, right? Just to kind of get off the ground, You need good data engineers. You need good data scientists. You need good privacy sort of folks. You need good security folks. And then at some point, you need, someone who understands the healthcare economic side to actually ask and answer an interesting question. And so as I started to kind of realize that, I really realized that I liked the opportunity to put people in a position to go and focus on what they do really well. And that's kind of what I continue to take through, to this day here at Particle is, we want to be able to hire really good data engineers that can focus on data engineering, really good data scientists that can focus on data science. And what I could help do because I had, an understanding of the engineering side of it, but increasingly more an understanding of all the other aspects of it was figure out how to, put everybody in a position to succeed. And so that's kind of what really sort of drew me to and gave me, I liked having that opportunity.
It's awesome. Yeah. And I won't get into it now, but we definitely want to ask about what that was like taking over, an existing company versus founding it from the ground up.
Yeah. Yeah.
Absolutely.
And going back to what you were saying about like finding the right people for the right positions and letting them, do their thing. Like, I think that's one of the things that I remember so well at Komodo. You were always identifying like the people in the right positions for, talking to the customer versus building with the customer versus building internally, for the analyses for our customers as well. So again, making sure you're identifying like the right people at the right time. Yeah. So, I just want to like kind of go back again to like Palantir, Komodo Health, thinking about the data science, the analytics. What were some of those like pivotal moments that led you to focus on the healthcare side? I know you talked a little bit about it before of what drew you to that, but was there, kind of like specific pivotal moments, even at Komodo, where you decided, hey, I don't want to only be on a data science, but now really focus on the business of healthcare solutions?
When it comes to healthcare and sort of thinking about better using, data in healthcare and how to think about these opportunities and use cases, right? So as I mentioned, right, my dad was diagnosed with prostate cancer, many years ago. And, he has the opportunity to get his care at Memorial Sloan here in New York, right? Which is obviously one of the most preeminent oncology practices in the country and in the world. And because of that, he very much had an opportunity to be eligible for a clinical trial and, get on an immunotherapy. And watching that experience for someone like him, it was all very seamless, not traumatic, or at least not overly traumatic, I guess I should say. And that was really great to watch, right? But then I think the realization that, well, a lot of people don't have that experience, right? A lot of people don't know about clinical trials that they're eligible for. They're being seen in the community and, being seen by a lot of, PCPs that are absolutely trying their best and trying to be informed and understand. And it was just such a fascinating problem. So, Rachel, you know this, even when I was at Komodo, I spent a lot of time thinking about some of the products that we built that really were designed to say, all right, just design the trial you want to run. Like, what is the inclusion exclusion criteria you want? And boom, we have all the data to turn this into a solution. And that wasn't enough, right? For a whole bunch of reasons that are, again, not technology oriented. I still think it's really fascinating that all of the technology today is built to go from, hey, I want a clinical trial that has these parameters, right, to test this new potential, life-saving, life-altering therapy that can really get us and whittle us down to not only here are the providers, but right here are, some of who the patients might be. And then if you can cross-reference and match that with registries to patients who've opted in and have said, hey, I'd love to be informed on this, right? All that technology exists, but we aren't doing it today.
Yeah.
And so that's part of where, right, like I realized that those were a lot of the questions that we needed to answer and ultimately solve if we're really going to, again, allow the technology to do what technology can do.
Totally.
That's awesome. Yeah. And I was going to ask you even, especially for folks listening, how do you define healthcare data interoperability and like, what does that mean for you?
Yeah, it's a great point. I guess I haven't done sort of that first step of just saying, hey, what do we do here at Particle? But fundamentally, right, when we're talking about healthcare interoperability and healthcare data sharing, the sort of first and foremost aspect is, if we're thinking about access to medical records, even as an individual patient. It is also the case, and it is something that's part of a big part of what we're trying to do here at Particle is, if you raise your hand and say, hey, I want access to my medical records, you're not really given access to them, at least not easily, right? Not programmatically. Even though, again, what we've done here at Particle, and part of the reason I was so excited to join, is the team here built out an incredible foundation and infrastructure that connects to health systems and providers all across the country in order to facilitate federating out queries and getting access to data, medical records for patients at scale. So at its core, right, that's what we've done. And then the question is, how do you start to construct that data and use that data in ways that benefit patients? And there's obviously a lot of options of how you can do that, but it's also driven off of a lot of regulations, and rightfully so. Very, very importantly, secure data like PHI, protected health information, is shared is really, really important. But it's also important that it does get shared, right? Often people forget that the HIPAA, or the P in HIPAA, stands for portability. Right, it was always intended first and foremost to ensure that these medical records, that if they belong to anyone, belong to the patient, right, are getting shared and used to promote, right, that patient's well-being and needs. So that's a long about way of saying that at its core, right, we provide access to medical records at scale, programmatic access, and we do so to promote, right, how those records can be used to benefit a patient.
That's awesome. And then kind of back to that point earlier about how you joined once Particle Health was already pre-existing. Obviously, you were really aligned with the mission and what they had already built, but what were some of the other factors you took into account for being willing to take on that challenge? Because I can imagine a lot of pre-existing companies already have their own baggage in some ways, and they do things a certain way, and then coming in as a new person trying to make a big change can be challenging. So would love to hear how you thought about that.
Yeah, I mean, like I said, the core of what was here and what was built was just so enticing. Again, as we've talked about, I spent 8 years at Komodo, kind of in that same style of going from, again, 20 people when I joined, all the way through to 900 plus or whatever by the time I had left, talking about, IPOs and things of that nature. And so that growth was a lot of fun. And there's different, kinds of companies that exist at each of those stages. And so it was really exciting to me, that kind of, Series B stage of, we've got something here, but we're really excited to kind of accelerate and build it out. It's just a really, really fun time. And it's a time I think that very much fits me and who I am and my mentality. And so as I, met the team here and understood more and more, it was really, really a clear that this was going to be a place where I'd be able to, bring some of my own, strengths to the table, while also, right, encapsulating and incorporating sort of this new world for, again, kind of the world of identified medical records was and still is in many ways new to me. And I was excited to learn from, a lot of the folks that were here already as, we kind of started to go through this journey of really changing, I think, the very fabric by which we as individual citizens interact with our medical records.
Yeah. I can really hear kind of obviously and see the passion that you have like around this. I think I remember you had posted even on LinkedIn a few weeks back about how, having better data access is not just about the business, it's really personal to you and your mission. What about it just feels so core to who you are?
Yeah, I mean, first off, I'm a big believer in, again, using data. I'm a big believer in, understanding where and how the transparency around how data is used. And not just in healthcare, I'd say in every industry, right? We all spend some amount of time, maybe some of us more so than others, right, thinking about how much data Google collects and Facebook collects and all these different companies collect, and thinking about some of those implicit and explicit sort of contracts that we sort of have and sign. And I think on the medical record side and the medical world, we don't talk about that enough. That's not understood enough, and I think it should be, right? I think it should be the case that we are given that transparency and we're given that access and we're given that control, because it is a really important part of, our lives. And I think the thing that's really interesting specifically about healthcare and medical records is it's the type of thing that goes 0 to 100 in terms of how important it is to you, right? Because frankly, unlike, I don't know, Spotify and listening to music, right? You don't want to necessarily interact with the healthcare system, right? You don't sort of wake up and be
Yeah.
like, man, what
Just
would
be
be great
working in the
is a
background.
hospital. Yeah, a
Yes.
hospital.
Yeah.
But when you do, right, when you do have to interact with it, you really need to, you really need it, right? And it's really important.
Yeah. And you need to trust it too, right? You need to have that trust with it.
Yeah, you need to trust it, 100%. And I don't know if this is what you were referencing, Rachel, but I did have my own sort of personal experience with this relatively recently. It was I have a 5-month-old son,
Well,
which is
congrats.
very fun. Yes, thank you. And he's really great. His name is
It's super
James, and
cute.
Aw,
yes, yes, he is super cute. But when he was born, he had elevated bilirubin levels, which is a indicator for jaundice. Not very uncommon by any means, but we ended up getting discharged from the hospital, and they said go see a pediatrician. First thing tomorrow, get these checked. And we went through a period of like 5 days where it was kind of our daily routine. We would go to the pediatrician in the morning to get the levels tested. They would say, "Man, he's gaining weight. He's going to be fine." And then we would hear at the end of the day, hey, they actually haven't decreased, or it's still
Mm.
problematic, come back again tomorrow. Until the fifth day, they actually recommended that we go to the ER. I didn't realize this, but now I know that there is no, infant ER. When you're going to the ER, you're going to the
my
ER.
gosh.
So we have a 5-day-old son basically that we
Whoa.
need to bring to the, regular ER. And, that's super traumatic. We got our way back finally to a room, and basically they asked to see, right, his bilirubin levels, because the whole important thing is not only where the levels are, but how they've trended as you go along in time with his life, literally. And so I had to, it was a different hospital that he was born at that had levels, and then it was our pediatrician. And so I'm pulling these up on my phone, and the nurse is like, "Oh, let me just take a picture." And I was like, take a picture. Like, don't, you have ways to connect this
Yeah.
data. And that's part of the interoperability framework that, is provided. And, she basically said, we don't really trust that. We don't really use it. So it's just easier for me to take a picture and just manually enter it in later. And so,
Wild.
my first and foremost was just like, make sure you write it down the right way. I don't want you to make a mistake.
Yeah,
But as I
totally.
reflected on it, right, it's just that's the world we live in, which is still so crazy. And my son's great. He's doing phenomenally. It was all good. But obviously, there are plenty of other people out there where it's not necessarily something that ends in an okay fashion. And being able to have access to that data is life impacting. And so those are the type of moments that I do get really invigorated in the mission and the importance of this. Because again, all of us at some point are going to have to interact with the medical system for either ourselves or loved ones, right? It will happen. And when it does, you want access to your data.
Yeah,
Totally.
I haven't had that traumatic of an experience, but have had that experience even with my first pregnancy. Just even calling like the after hours nurse at the same practice versus talking to somebody during the day, I'd have to kind of repeat the whole story again, repeat the measurements and everything. And I was just shocked that even there, like, there's no way to share the data when a lot of them are using some of the same systems like Epic and everything. So it's wild.
Yeah.
Glad you're
Yeah.
tackling this.
And that, in a nutshell, is what Particle does.
Yeah,
We enable the sharing of that data.
it's cool.
Yeah, well, speaking of Epic, Amber, great segue. Let's talk about the lawsuit that you filed against, or Particle filed against Epic Systems. Obviously, you're going up against one of the biggest players in health tech and accusing them of blocking access to critical patient data. Most founders, I think, would probably avoid that fight. Why do you think this was the moment to draw that line in the sand?
Yeah, well, the hospital system that we went to, the ER we went to, NYU Langone, they were great. They were phenomenal. An Epic system, right, that they said did not work particularly well in terms of allowing access to that data. So, I think, so first and foremost, I think it's really important for me to make it clear that, Epic accused us of some privacy and security concerns and issues. Those issues and concerns were very explicitly investigated. And it was found that we did not do anything wrong. And to this day, Epic has not rescinded those notices, even though there has been not a single shred of, privacy and security violation that has been, found. Because we didn't do anything wrong. And instead, they wanted to attack us. And that's really what we found to not be okay. That's what I found to not be okay. I think, when we, again, I come from this, I'd say, very naive technologist standpoint, right? Of we should all have the opportunity to build great things. And if we build great things, then people will use them. And we will continue to innovate as a society. And that sort of, entrepreneurial mindset, I feel like is very core to who I am. And this was kind of a wake up call of like, oh, well, there are times when that sort of naive view gets attacked because the fact that you are doing something better and different is actually going to get people are going to want to attack that. They're going to want the status quo to remain the way it is. And so I felt like I really had, two options here. One option was just to quit and say, okay, I guess, we're not allowed to innovate and build. And the other option was to fight. And so we sued Epic. I think that's a really important point. This is not an Epic litigation that they drove, right? We sued them because we really believe that this behavior is inappropriate. And for everybody out there who's trying to build a better world in the healthcare community, we felt like it was important. I felt like it was important to take action. As I mentioned, fundamentally, we sort of see ourselves as through some of these laws and regulations, and specifically the Cures Act, which says we all are allowed programmatic access to our medical records.
Right.
We wanted to make sure that we push that forward. Suing them was part of, overall ensuring that we continued to get the rights that we should be afforded by the laws that exist in this country.
Super inspiring that you were willing to do that, but I totally follow your thought process. It's like if you don't draw a line somewhere, it just keeps moving. And like you said, we can't have any innovation. And especially in healthcare, it's one of the most important sectors. And there's such widespread dissatisfaction with where healthcare is at right now. And there's no way we can fix it if we can't work together and integrate with key systems and find solutions. So, yeah.
Yeah, it's I think polling satisfaction in healthcare is probably one of the one things that certainly dissatisfaction of healthcare is probably one of the few things that brings all Americans together.
Literally anyone.
Right, these
Everyone
days.
together on this. Yeah.
Right. And
It's
so
a safe
I think
dinner table
there's
conversation. Yeah.
yeah, exactly. I think there's so much opportunity, like I said, to innovate and do things better. And there's so many different sort of folks that are attacking different angles, and we have a long way to go. And I'm hopeful that we as a society can continue making it better, one step at a time.
Yeah. And how personal does this fight feel to you? Like now that you've kind of taken that step and you're like, okay, now we're doing this, it's clearly not just a business dispute. So would love to hear, it's more about the patients as well.
Yeah. I think, again, having that experience with my son, sort of, seeing, frankly, even our team here, right? The team that I had, come in and sort of said, hey, I'm here. I want to lead this team and I want to be part of what we're trying to build. Yeah, of course it gets really, you absolutely get fired up because, again, I go back to that sort of, naive feeling of, this, this world, this space, this industry, just like any industry, should be sort of driven by folks that are trying to make things better and build. And when, you see people just trying to cut that down, yeah, it's super frustrating and definitely something that I felt at the core, especially knowing that what we're talking about at the end of the day and the actions that Epic took in blocking access to patient data was impacting people, right? Lives are at stake. So feel the magnitude of that every day.
Yeah. And on the flip side, with what you're doing at Particle Health, given that healthcare is so notoriously fragmented, how exactly does your platform integrate and streamline data to kind of benefit both the providers and patients, especially with systems like, obviously Epic is a huge one to integrate with, but are there others, and like how does it all sort of work for you?
Yeah, no, it's a great question, right? So, fundamentally, as I mentioned, a lot of the sort of starting point for all of this access to data is built off of the Cures Act, which says, data needs to be made available. And if it's not, right, that's information blocking, and that is a penalty, and there should be repercussions that are put in place. So over, the last, and again, that was, went into effect almost a decade ago. And so in the last decade, there has been progress that has been made. There are national networks that we are connected to, as well as state HIEs, which allow us to start to federate out access. Again, speaking of...
What's HIE again, just for us and our audience?
Thank you so much. Yeah, HIEs are health information exchanges. So again, there's been these exchanges that have existed for a long time that are intended to help to facilitate the exchange of information And those HIEs are often at the state level or a geographic regional level, really trying to help to facilitate, again, the connections between providers who are all within sort of a similar geographic area. And in that last, 10 years or so, again, these national networks, Care Quality, Commonwealth, eHealth Exchange, as three of the primary ones, have started to aggregate more and more. And it's really mainly EHR based. So Care Quality is sort of Epic's, network. Oracle was originally Commonwealth, and so on and so forth. And so we created connectivity into each of these different sort of networks. But what you get out of these networks is not information that's particularly usable, right? It is often unstructured, very messy XML files that are not something that you can just say, great, here you go, put this in front of a doctor and they're going to be able to make heads or tails of it.
Well, they're not
So
incentivized to do so, right? Like their their
totally,
business.
this is, yes, this all comes back to economics,
It
of
always
course. I'm
does.
sorry.
Yeah, because I always think
Follow
about
the
like
money.
how, yeah, like it's, it's odd for a company like a health system to say, oh yeah, I should share my data about my customers with my competitors, which is another health system. But in this case, customers are the patients. So like, again, it's just a very different on healthcare side, like the feeling that you have around like your data and the sensitive nature of it. So sorry, I interrupted you on that, but yeah.
No, I think that's exactly right. And I think it's really well said, right? That, if you think about this from a pure, again, economics perspective, right? There is nothing surprising or really even fundamentally wrong with a health system, right? Saying, I don't want to share, my competitive information with my competitors. But that's why, right, regulations needed to come into play here, because we're not talking about, Candy Crush user data. We're talking about people's medical records. And that is the type of information that makes the difference, again, between patients knowing and doctors really knowing as they're treating those patients what treatments have already been tried and whether they're effective or not. Or even something as simple as what are they allergic to, right? And that is critical information in those moments that matter for a patient. And so that to me becomes a real core part of understanding the dynamic here, is understanding that fundamentally, there's a reason that the regulations needed to be written and needed to
Yeah.
be passed so that we could do what is in the best interest of the public good, because this is an industry that needs to be regulated. Of course it does.
Yeah. And so how does Particle ensure that data security, just again, given the sensitive nature of medical records and while at the same time promoting that interoperability piece?
Yeah. So we have all of the correct accolades in place here in terms of SOC 2 high trust, right? So there's absolutely a lot of the technical requirements around ensuring that HIPAA data is being sort of processed in the correct manner. So first and foremost, right, that is the necessary but not sufficient condition. That is true. I think the next aspect, as you're thinking about how to correctly kind of process and think about information like this, is really tying it to what are you trying to accomplish and ensuring that you are taking into account those needs as you are kind of making that trade-off between data usefulness and data security, right? And that sort of concept has been one that I personally have just really loved exploring for the last 10 years that I've been
I
in
remember
healthcare.
at Komodo, we always had these debates, right, around it.
Of course. And it's something that I always lead off with because I love this concept of the trade-off, if you will, between data usefulness and data security. Because of course, right, the best way to ensure that data is not compromised is to not have it, right? To delete it, to
Yeah,
get rid of it.
Totally.
If we just deleted all the PHI in every health system,
no,
there would be
yeah,
no concerns of any type of security breach, right?
yeah,
Obviously, that's an asinine thought, and that is actually designed intentionally to sort of show that nobody thinks we should be going to that extreme. At the same point in time, right, to say, hey, we're going to make this data available publicly because it might make for an interesting school project for someone would also obviously not make sense on the other extreme. So it's all about
yeah.
understanding, where is that sort of spot that makes sense for us
Mhm.
to again, this is why regulations are important, right? Complying with all the regulations, complying with all of the framework around this, but then also saying, well, what are we trying to accomplish? What are we trying to do here with this data? If it is something that can lead to, someone's treatment being informed, that's probably a trade-off that they're willing to make. And then we as society make these rules and laws to determine some of those trade-offs at scale. But yeah, I would much rather, I don't really care if some random doctor that I've never met accidentally sees my medical records. If when I go to the ER and I'm unconscious, they have access to see mine,
Totally.
which could lead to some life-saving interventions.
Yeah.
Yeah.
Totally agreed.
Yeah. And it sounds like in your case, you're pretty pro regulation because, without it, healthcare would just be operating like a capitalist sector, like all the other sectors, and it would not always be working in the patient's favor. But I'm curious, if we step back even from particle health and look at the regulatory environment itself across healthcare, how would you kind of grade it in terms of, there's some areas where maybe we don't have the regulation that we need, and then there are others where maybe we have outdated regulations. I'd love to hear kind of your outlook and where you are on the, sort of optimism versus pessimism side, and what you think we kind of need to do.
Yeah.
Yeah. I know,
Well,
loaded question, but
it's a
yeah.
very much a loaded question that I could take in many different ways. I think there's a couple of things that come to mind. So first off, I absolutely believe that healthcare needs to be regulated because, again, you are talking about, patients' lives within an industry. That is literally a definition of what this industry is designed to focus on. And so we should make sure we have controls. We should not allow capitalism in that sense to just run unchecked. I also think, though, one of the things that I find very interesting is, and there's been people who have talked about this, about Epic, though not just Epic, this idea of regulatory capture, right? So that there was a lot of laws that were written in terms of high tech, which really promoted EHRs to be purchased and then meaningful use, which really promoted them
Yeah.
to be used, right? Paying providers in order to use medical record software. And there's been a lot of economic studies done, asking how effective this was or wasn't. But I think what's important to note is, these regulations can actually lead to the promotion of incumbents, right? And it's not always the case that it is, regulations that are going against, the large titans of the industry. It can really depend, especially in an industry like healthcare. So that's kind of another interesting thought I have in terms of,
Yeah.
often we think of regulations as really, kind of constraining some of the, technology innovation. And in this case, it can often be the opposite. But what I'd also say in terms of where I am generally is, again, I think we are in a position where as long as we are following the regulations and laws that we've put in place, I think we are in a position to really kind of see the right check and balance that exists between safety, security, and then obviously promoting interoperability, which is in the benefit of patients and individuals. It just is really important for these regulations to be enforced. So the enforcement is really what I spend a lot of time these days thinking about, especially frankly in some of the swirl that is the defunding of HHS
Yeah.
and where and how that will impact the future state of, and I'll use another buzzword here, TEFCA, which is the Trusted Exchange Framework and Common Agreement, which really governs, right, sort of this interoperability exchange. But that whole agreement construct framed as a positive, it only matters, right, if we enforce
Right.
information blocking, which is really the penalty that needs to exist to keep people in check.
Yeah.
So if that's not successfully enforced, then we're going to be in a position where we don't have those necessary checks and balances.
Yeah. No, that's super interesting. I feel like there's like so much that's happening right now. I was reading about even Trump's AI memo where he's kind of like moving away from, I think, the Biden era, which was more like AI safety. Like that was like, an AI safety first kind of like more model to an AI innovation first. And some of the people are saying like, is that going to mean that there's going to be less regulation on the safety aspects? And then who's going to be checking the safety aspects of all the new innovation that's coming out? And so, yeah, similar to what you were saying, like if no one's enforcing TEFCA, what's the point of it existing there?
Exactly. Right.
Yeah.
It's not a particularly useful construct if you only follow it when it's convenient.
Right. Yeah.
Yep.
Definitely.
So I'd love to switch gears and ask sort of an internal question because we've talked a lot about who particle health is in the larger ecosystem of healthcare. But I'm curious what you think kind of the special sauce is in terms of how you structure particle health internally or the sort of people that you hire there. What do you think the company really has going for it behind the scenes?
Yeah, no, I love that. And I think what's always true is that you are any type of company, any type of technology company where you're trying to innovate in this way. People can talk about, technology moats and all of those things. But frankly, I think ultimately it comes down to the people first and foremost, right? That is the secret sauce of Particle is again, the folks that are here and looking to build our platform and build the mission that we are looking to accomplish every day. One of the areas that I certainly have a lot of appreciation for, certainly a soft spot for, if you will, is our data science team. And I think in many ways we are continuing to build and grow out, first in class, best in class data science team. And
Awesome.
it is a differentiator for us. Again, I think a lot of folks in the kind of interoperability space, think of it as, hey, we're just kind of pumping data from point A to point B. And I recognize firsthand, and I feel like it's all of my career in a nutshell, to understand that like that's not really enough. If you're not, helping people understand where and how to contextualize that data and use that data, then it's not really useful, right? I've always said that data in and of itself is not useful. It doesn't help you to answer a question, right? You can't eat it. You don't cure diseases with it. It's only useful insofar as it answers a question and gets you to a different decision than you would have taken otherwise. And that's why, right, being able to be opinionated about the data and opinionated about the right answers is so important. And that's a lot of the sort of cultural ethos that we've established here within the team that I think is a really important part of how we're going to continue doing and building and innovating the way that we have.
Yeah, I remember that very much. In our one-on-ones, I think that's been kind of really ingrained in me of data is only as useful as the decisions you can make from it. So I do have always you to credit for that.
Appreciate it. Appreciate it.
Well, reflecting on your journey also, do you have any advice that you would give to engineers looking to transition into leadership roles in the healthcare sector, or if they're, thinking about like founding a company as well?
Yeah, I mean, I do think it is important to understand why you want to do it. Right. I think there's really trying to sketch out what do you like doing, what do you enjoy doing. When it comes to it, I think I spend and I've given a lot of engineers career advice when it even comes to the question of should I go down more of a people management track versus kind of an individual contributor track, and to a certain extent, right, sort of kind of expanding into this type of leadership or founding your own company. You really have to, right, think about what your goals are and what you want to do and what you want your day-to-day to look like. I will say that anybody who's kind of in this position of founding a company or leading, being part of leadership of a small company like we are, you have to be comfortable being uncomfortable, and you have to
Really?
be willing to in many ways embrace being a generalist, right? And that's hard for a lot of people to do, especially engineers, folks that really want to say that they have a skill that they have continued to hone and craft for decades and decades. You can't really do that, right? Because the whole point is you don't know what tomorrow is going to bring, and you don't know what you're going to need to throw yourself at. And so I think this idea of in many ways sounds there's certainly people who have that itch to say, I want to go on that founder's journey. And it obviously, for the right person who does gain energy from that and is excited about innovating and sort of that entrepreneurial spirit, right? That's amazing. And that I think is, again, my naive sort of way of thinking. I find so much beauty in that. But I also think it is recognizing kind of, what the day to day is. And it is a lot of being able to react and be able to again, get to 80% in 20% of the time and be comfortable that you're not really going to get any further than that. And so that's kind of probably my biggest piece of advice, especially again for engineers who tend to be more in that perfectionist camp, right? Folks that just want to get to the right answer, not just the effective answer. And I think that's a big part of it is you got to learn to be comfortable being effective, not being right.
I
It's
love
really good
that.
advice.
Yeah.
Yeah. So what's next for particle health? Are there any upcoming innovations or expansions we should be on the lookout for?
Yeah. Well, I mean, one of the first and primary ones that we're really excited about is, continuing to push further and further into our work in supporting health plans.
Oh, nice.
So a lot of our kind of primary way that we've worked in the past has been around providers. But what we're realizing is we started kind of with kind of core providers, and eventually we expanded more and more into value-based care, because there's this really great alignment where value-based care companies are going to care more and more about where that patient is in their longitudinal journey and understanding right how best to navigate it and help them navigate it. And that's also just a natural sort of push and jump into health plans, right? We're trying to understand more and more so in a really great way, what are those moments that matter for patients, and being able to ensure that they can, interject and intervene. And let's be very clear, right? As we've talked about, there is an economic motivation to this, but thankfully it is one that is pretty aligned with the desires of the patient themselves, right? Which is like to not be in the hospital. And so if there's that ability to ensure that people are, following up with specialists, right, ensuring that, there isn't a medication mix up or medication combinations that are impactful. And that's a lot of the type of work that health plans are starting to get more and more into in terms of having that direct patient care and direct patient outreach. And that's a lot of what we're really excited to continue to, offer up into the market with Particle's payer platform. And so that is a huge part of kind of our 2025 and what we're pushing on. And then as we look into the future, of course, we're going to continue to bring it back to the patients themselves, right? And how we help them navigate those moments that matter, how we continue to push this information into the hands of the patients and giving them the control and access. Because fundamentally, I'd say our goal at the end of the day is to help patients use and access their own data to keep them out of the hospital. That's what we're trying to accomplish, and we think if we kind of keep that at the forefront, we'll continue to make the right decisions about where to take Particle.
Yeah. And I promise I'm not trying to set you up for a sales pitch here. I'm asking for selfish reasons. Is there anything patients can do to advocate for better interoperability? Just because, I'm listening to this, and I'm sure there are other people listening to this saying like, oh my gosh, it's overwhelming to think about the number of doctors I've seen and how they all have different pieces of information about me, and I can't find them in one place. Is there anything we can do?
Yeah, so I guess a couple things I would say. So first off, you certainly can go to our website and look at our information blocking page and ensure. I think we still have a petition that you can sign, so people can and should go to our website for that purpose. Second, I think whenever you're talking to your providers, right, you should, and frankly, even anybody in the ecosystem, hey, do you have access to my medical records? If not, why not? I actually have joked before that it's kind of only a half joke. Part of the reason that I wanted to join Particle is I just thought it was so annoying that I would go to, the doctor and I'd have to sit there and fill out a form every single time.
Yeah.
I'd be like, I've already seen this
Still
doctor
doing
12
that
times
all the
before.
time. Yes.
And like, why are we doing that? Right? Like, why are we doing that? So whenever you're doing that, again, don't bother, receptionists, that is probably not their fault, right? But when you talk to the doctor, right, finally, it's hey, do you know that there's a different way you can do this, and why aren't you doing that? And then finally, we're going to continue to be pretty active on the kind of coalition building front as we continue to push as an industry, and we're talking to other folks within the industry, our competitors, even, right, folks that all again care that this is important. And so we're looking to really build out that coalition. And part of the reason we're building out that coalition, to bring it back to your question, Amber, is to really put forth to our representatives within Congress, right, this question of why has information blocking not been enforced? We have an information blocking complaint that has been sitting with HHS now and with the OIG for over 6 months. And we still don't know, right, when we're going to hear back. And like I said, that's a problem. And so that, I think, is something that we all can, again, take to our representatives and say, this is important to us.
Awesome. Thanks for sharing.
Awesome. Well, let's move over into our quick fire round. So this is just going to be fast. You can say the first thing that comes to mind.
Sounds
All
good.
right. Biggest myth about healthcare data interoperability?
That it exists for patients to access their own data today.
What's a tool or resource that you can't live without in your daily work?
So for this, I think as much as I have a love-hate relationship with it, I definitely would say Slack.
Nice, same. One book or podcast you'd recommend to aspiring health tech entrepreneurs?
So I really like Derek Thompson's Plain English. I have been spoiler alert, a big Bill Simmons fan for my basically entire life. But I think Derek Thompson, he had a podcast actually about healthcare back in December, which I highly recommend people listening to. I think he does a great job.
So, in one word, what does the future of healthcare look like to you?
Innovative.
I thought you were going to say interoperable. My new favorite word. I'm getting good at saying it. A
That would
personal
have been good
habit.
too.
Yeah. Yeah. What's a personal habit that contributes to your success?
I think it's always trying to take a couple seconds to reflect. I think, as you could imagine, right, if you're, suing one of the largest companies in the space, the reasons behind that are certainly very frustrating. And I definitely, as you guys can tell, I'm a pretty passionate person. So I think the one thing that I've kind of learned is just to take a second, reflect, think, process.
And then, what's the most unexpected challenge you face as a CEO?
Prioritization, which I know sounds like kind of an obvious answer, but but truly there's no one else to blame, right? And so a lot of it is just really understanding where best to focus your efforts. Time is limited.
If you had a magic wand, let's say you get 3 wishes, what's one thing you would wish for? Number 1, yourself, number 2, particle health, and number 3, the future of healthcare data interoperability.
So I think for myself, it is to continue basically hiring everyone we need to hire, right? If I could just say everybody that we're trying to hire, they're hired today. So recruitment, I think, would be sort of the magic wand for myself. And I recognize that maybe that's a particle answer, but no, that's really for me answer for sure. That would really help me a lot personally. For particle health, of course, I'm going to say, successfully pushing this lawsuit to its conclusion and sort of seeing this set the stage for other innovative health tech companies to come along and not be hampered and hindered by the state of again sort of how folks in incumbents like Epic like to sort of use the rules to their advantage or lack of rules to their advantage. And then in terms of future of healthcare data interoperability, again, my magic wand is patient raises their hand, says I want access to my data, and it's there for them.
All there.
Right?
I would love that.
I know everyone would definitely want to have that for sure. So, well, Jason, thank you so much for joining. I mean, we were so happy to have you on the podcast. And where can people find more information about you or follow you or Particle Health?
Yeah, no, first of all, thank you guys. This was super fun. Whenever you want to have me on, I'm more than happy. This has been
This is
great.
awesome.
It's mostly LinkedIn. I'm not a huge X tweet type of guy, but no, LinkedIn is where people can follow me.
Sounds good. And we'll add the information blocking hopefully to our show notes as well so people can find it.
Yeah, please do.
Yeah.
Thank you.
Thank you so much, Jason. This has been great.
Thank you, guys.
Loved having Jason on. I'm sure you could tell he was very, very passionate about what he was talking about. And yeah, that's kind of like been my whole experience with him.
Yeah. Yeah. And having worked with him and now this, what resonated with you most in the discussion?
Yeah. So kind of what I said before, he's clearly someone who really believes in what he's doing. I don't think anyone would choose to not only be a leader, like a CEO of a company, but then also on the side or maybe on the forefront, choose to sue a huge incumbent because of the personal mission. So the fact that he's willing to take on Epic because he really believes that they were blocking information and affecting patients. And when he talks about that, right, like it's so core to who he is.
Yeah. And just for anybody who's listening to this and doesn't know what Epic Systems is, this is not some random large healthcare company. This is like the healthcare company. It's the electronic medical record system behind a lot of the doctor appointments that you're sitting in. So if you see your doctor typing something on their computer during your appointment, they're probably in Epic. So that's how big of a situation this is. And I think how noble it is that he's willing to take on such a huge company that has its hands in so many different spots of the industry. And then back to what you said, Rachel, the mission aligned CEO. He clearly fits that mold. And that's something that just time and time again, we tend to look for at the Council Fund, even in our top 3 attributes of founders that we look for, even in the first conversation with them, is just, why are they doing this? Does it tie to some personal mission that they have? Because if not, obviously times are going to get tough. He even said it himself. In order to be a founder or an entrepreneur, you have to be comfortable being uncomfortable. And really, you're not going to be comfortable if you're working on something just to make a lot of money.
Totally.
You're going to be, out of there in a second if you realize you could be making better money doing something else that gives you less stress. So
Yeah.
I think just understanding why you want to do it, that's come up in a lot of our conversations with some of these top operators, top founders. And it's no surprise to me because I just see that that's really the thing that gets them through those tough moments. And then I also loved how he talked about being generalist as a superpower as a CEO. I think we've heard that in multiple conversations, even in our last conversation, earlier today with another guest. They were talking about how even in the age of AI, early stage employees also should be generalists, which is so different than even not so long ago when I was working at Cruise before I went full-time in venture. The generalist thing, everybody was worried they weren't enough of a specialist. And now today, with all the tools that we have and all the hats we have to wear, whether we're the founder or on the early stage team, it's better to be able to be flexible a little bit, but have something you're good at, but be able to shine in other areas too.
Yeah, definitely. I had the same experience as well. I always felt like I need to specialize more or have a foundational skill set. And I found, being a generalist has been just so advantageous. Like the more and more I've progressed along my career as well.
Yeah. So. And one of our angel members, Anne-Marie Guzzi, we were talking about this prior, but she recommends a book called Range, Why Generalists Triumph in a Specialized World. I haven't read it yet. Have you?
I haven't either. It's on my list. So
nice.
I think I have it hopefully coming soon from Libby. So
yeah. At this point, it just has come up so much in these conversations and I was a generalist before this and would consider myself to be a generalist now as a VC. So I want to read it for sure.
Yeah, definitely. Well, if this episode sparked ideas or insights, drop us a review, share it with your network, and subscribe to First Builders wherever you listen.
Awesome. See you next time.